Hello guys, today we're going to learn the basic stuff of the skull. So here we have the skull in 3D view. So skull, it's the skeleton of the head and it contains 28 bones in the skull. So let's get started. So if we place the skull on the frontal side, we can see many bones. So the first bone is the frontal bone. This is the frontal bone. So it's the it's the bone that forms the forehead, and it's smooth and convex. It protects the brain, and also it's one of the strongest bone of the face. So in the frontal bone we find this structure called frontal tuberosity. If you feel your forehead, you can feel the tuberance on your forehead. This is called frontal tuberosity. And also we have the elevation of bones beneath the eyebrows. These are called superciliary arch. And the superciliary arch, where they meet together, they are called glabella. And also we have another structure here. It's where frontal bone and the nasal bone meet together. This point is called nasion. So the next bone we have here is the nasal bone. These are the nasal bone. It is two in numbers, and these are small bones, and it is most commonly fracture bone of the skull. So the next bone we have here is the maxilla bone. It is two in number, right maxilla and left maxilla. It forms the upper jaw of the bone. It is the second largest bone of the skull, and it forms the part of the face, nose, mouth, and also orbit. And the shape is pyramidal in shape. It is joined to the other bones by four processes, which are here on the we can see here. It joins the frontal bone, also zygomatic bone here, and it also joins the alveolar bone and also palatine bone, but you can't see from here, it's inside the mouth. And maxilla, it is also called the pneumatic bone, as it has hollow cavity inside the bone, and these structures are filled with air, and it also makes the skull lighter and provide the resonance to the voice. So if we get the infection through these sites, we suffer from sinusitis. These are called zygomatic bones. It is two in numbers, here and here, this, and this from the upper and lateral part of the face and from the cheekbones. It and these are called zygomatic arches, this extension, and they connect with the frontal bone here and temporal bone here and also maxillary bone. So the next bone we have here is the mandible. So it is the bone that forms the lower jaw, and it is the largest and strongest bone of the face. It develops from the first pharyngeal arch, and also the shape is horseshoe shape, and it has a body and ramus. So this is the body of mandible, and the ramus is this is the ramus of the mandible. So in the mandible, the most commonly fractured region is at the canine region. So if you see, this is the most common fracture area. So sometimes the nerves present passing through this foramen, when get involved, it may causes neuralgic pain. So the upper border of the mandible give lodgement to the teeth, and the base, the midpoint of the base, this is called mental point. And this line which divide the mandible into two equal half, it's called symphysis menti. So this is the symphysis menti. And here we have the mental foramen, where nerves and blood vessel passes to supply the mandible. And here we have the neck of the mandible. This is the neck of the mandible, and it has a condylar process here and coronoid process here. So another bone is the parietal bone. This forms the large portion of the roof and the side of the skull. So this is the parietal bone. It is quadrilateral in shape and it is smooth. The next bone here is the temporal bone. It is situated at the side and also covers some base of the skull. Here we have the interesting structure called terion. This is the structure where these three sutures meet at a point called terion. This is the common structure which gets fractured during roadside accident, which may rupture the artery leading to hemorrhage inside the skull, and it may lead to paralysis of the opposite side due to compression of the motor area of the brain. Here's the another bone called sphenoid bone. This is the sphenoid bone present on the both sides, and it resembles the bat with stretched wings. So it has two wings, lesser wings and greater wings of the sphenoid bone. So the another bone is the ethmoid bone. It is present inside the skull. This is the ethmoid bone. It is present between the orbits. In the posterior portion, we have the bone called occipital bone. This is the bone which forms the posterior portion of the skull, and also it has the largest foramen called foramen magnum. This is the foramen magnum. Foramen. This is the foramen magnum through which spinal cord passes and connect the brain. Also, we have the another structure here. These elevation are called occipital protuberance. Occipital protuberance, and also we have these lines are called superior nuchal line, and this is called inferior nuchal line. Let us also talk about some sutures present in the skull. So this is the coronal suture. This is the coronal suture here, and this is called sagittal suture, and the point where they meet together is called bregma. This is a bregma, and in the posterior side we have another suture called lambdoid suture. This is the lambdoid suture, and this is the sagittal suture, and the point where they meet is called lambda.